If you suffer from cluster headaches, you already know that they can be extremely painful and hard to treat. If your current treatments don't adequately control your cluster headaches, the caffeine treatment in this video may help. Now, individual results will vary, but the caffeine treatment works for me about 80% of the time, and it does so very quickly. I have made this video in the hope that it will help others find an effective alternative treatment for this serious condition. Before trying this treatment, it's recommended that you discuss it with your doctor. However, this is not a commonly known treatment, so don't be surprised if your doctor doesn't know anything about it. The underlying cause of cluster headaches is complex and not completely understood. However, the immediate cause of the pain is the swelling of blood vessels around the eye on just one side of the head. Caffeine is a vasoconstrictor, so it reduces the swelling of these blood vessels and thus reduces the pain. To get the purest and fastest acting form of caffeine, purchase it in the powdered form. If you don't have any caffeine powder, you can make some yourself by crushing caffeine pills. This is convenient because you can buy the pills at any drugstore. When you're in an area where inhaling a white powder up your nose may look like something illegal, swallowing caffeine pills is a very convenient alternative to use. However, swallowing the pills usually requires a larger dose, which is more likely to cause side effects. According to the Mayo Clinic, up to 400 milligrams of caffeine a day appears to be safe for most healthy adults. I sometimes use caffeine twice a day, so that adds up to about 600 milligrams. Now, I haven't had any problems with that. However, that doesn't necessarily mean it's safe for you. So I highly recommend that you start with a small dose of caffeine to start. Gradually increase the dose until it either works for you or you notice undesirable side effects. Inhaling the caffeine works best because it gets directly to the area of the pain. It also works faster, and you don't have to use as much. Another factor in the success rate of using caffeine is how soon you use it once you feel a headache coming on. Usually, the sooner you use caffeine, the more effective it will be. Inhaled caffeine can be perceived by the body as an allergen. This can result in the release of histamines, which cause the dilation of blood vessels. The dilation of blood vessels is, of course, something you want to avoid. So, if this becomes a problem for you, try using an antihistamine, such as nasal crom, before inhaling the caffeine. It's very important that your nose is not stuffed up when you try to inhale the caffeine powder. If needed, just blow your nose, or if needed, use a decongestant spray before you use the caffeine. It's also important to blow your nose after the caffeine starts working. This will relieve any congestion you might have, and it will also expel any of the caffeine that wasn't already absorbed. So if you inhale 400 milligrams, the actual amount that is absorbed will actually be somewhat less. Finding caffeine powder can be difficult. However, at least as of December 2022, it is still available on eBay. If you find that it works for you, you might want to stock up in case it becomes hard to buy in the future. The more caffeine you take, in any form, increases the chances of undesirable side effects. So, you should carefully limit your consumption of food and drink that contain caffeine. Many cluster headaches occur at night. If the caffeine treatment interferes with sleep, a prescription medication is the logical choice. In fact, using only one treatment can lead to a reduction in its effectiveness and the possibility of rebound headaches. I hope this video will be helpful in your search for how to manage cluster headaches. And, especially if it works for you, I would appreciate you letting me know. Thank you.